Awesome. And we're live. Cool. Hey, Dr. Colin, thank you so much for joining. We just went live here. We got some people join in, so we'll wait for a little bit to see how many people join. This is our first.
I can't hear you.
Oh, you can't hear me?
No.
All right, guys, hang tight. We got some people joining.
Sorry.
Welcome. No worries, take your time. Can you hear me now? No, you can't?
Technical difficulties. No, I can't hear you. Here, let me see if it's on my end.
Click settings at the bottom of the.
What about now?
Can you hear me now?
No.
Hello, hello. All right. Leah, could you check out the live and just make sure my audio is coming through on the live?
It is.
Oh, I can hear you, Leah.
Yeah.
Is Colin's coming through on the live?
I can hear both of you.
Colin? That's weird. So Colin can hear you, but he can't hear me?
I guess so.
Hey, to the two people who are watching this, thank you for your patience. Situated.
Let's see. Okay, we're live on YouTube, Instagram. Select go live once your software connects and displays. Cool. You might have to go onto Instagram because I don't have the.
Okay, that's fine. Let's figure out this technical issue and then we can go live on Instagram. Colin, can you hear me now or no? No, he can't hear me. Leah, can you ask him if he can hear you?
Can you hear me?
I can hear you.
Is this so weird?
And Leah,
you can hear me, Leah, okay?
I hold all power.
Why don't here? I'll leave and come back. Let's try that.
Okay.
You can hear me, Leah, too?
Yeah, I can totally hear you.
Good. Yeah, I don't know.
Yeah, I have no idea what's going on.
Technical difficulties.
Instagram is.
Can you hear me now?
Yes. Yeah, you are.
All right. It's that old trick.
Hey.
That works. All right. Thank you. All right. There we go. Cool.
Do you mind going on to Instagram and just selecting public audience and then selecting go live? Because
got you.
For some reason I can't even select it.
Perfect. Yeah, I will do that. Thank you, Leah.
All right. Bye, guys.
Dr. Colin, how's your day been so
good.
far?
How are you, Cole?
I'm good.
Good.
You don't see patients on Fridays, is that right?
No, I don't.
No. What do you like to do with your Fridays?
Fridays are catching up days. A lot of like errands, grocery shopping, gym, kind of like a decompress from the week. So not too much, especially today it's raining, so nothing much to do.
Is it raining in New York?
Yeah, and it's cold, so it's like a good day to stay in, but I catch up on stuff. I'll do some stuff for social videos and things while I have some downtime. So do some research and for social. So that's pretty much my day.
Gotcha. Let's do this. Sorry, I'm just getting us live on Instagram here.
You're all right.
It's weird. Cool. Awesome. All right. We're just going to kick things off with or without Instagram. No worries. Oh, there we go. Cool. We're live on Instagram now. Awesome. All right. Welcome in, everyone. We got some people joining in. We got 8 people here. So we're going to jump right into it. Today, we're going to be talking about biohacking and vaccines. There's a lot of news recently around vaccines. So we're going to be talking about some of the myths around vaccines. We're going to be talking about best practices in biohacking. So everything we're talking about today, none of this is medical advice. My name is Cole Seifer. I'm one of the co-founders of MedMatrix. I'm also the marketing director. And today I'm joined by Dr. Colin Renard. He's a provider here at MedMatrix. Colin, thank you so much for joining.
Of course. Yeah. I'm so excited to be here with you, Cole.
Yeah. So Colin, could you give it just a brief background on your experience in functional medicine and kind of what got you into this field? And then we'll jump right into the subject matter.
Sure. Yeah. I mean, I've been a functional medicine practitioner for about 10 years. I hold multiple board certifications and a fellowship in functional medicine. So I really got interested in it because I live it every day. Through the years of practicing, I've become much more involved in bodybuilding, my own biohacking, which we'll talk a lot about today. I'm really passionate about nutrition and health. And one of my biggest passions in life is really educating people on how to live better. I see so much struggle in people in their lives and their health. So I try really hard to live it and educate through the way I live my life. So I got into it mostly as a way of my own interest in my own health. How do I live longer? How do I optimize my nutrition? How do I optimize my fitness? So through all of that, it just resonated naturally that that's what I wanted to do as a career. So it's really nice to go to work every day doing something you love. It's not really work. So
that's awesome, man.
Yeah, that's how I live.
Thanks for sharing.
Yeah, of course.
So there's a lot of you hear a lot of terms thrown out there. So you hear functional medicine, holistic medicine, natural medicine, biohacking. So could you maybe explain the difference between like what biohacking mean, like the difference between biohacking and functional medicine? Because there is a difference, and we do both. But can you?
Yeah. I mean, functional medicine is really a philosophy of healthcare. So healthcare in the conventional sense, for most people, is a more traditional or Western approach is sort of what we would call it. And it's a very pill for every ill, as I try to educate people on, where you go to the doctor because you have something that's wrong already. You don't feel well, you're in pain, you have some sort of a symptom that you need help with. Most of the time in the conventional medical space, your doctor will give you something, a medication, recommend some sort of procedure, surgery, something to get rid of the symptom. The functional medicine approach is really designed to go the other direction of, okay, you don't feel well, but why? Why is it that you don't feel well? What is it that's not optimal about your body? And how do we reverse this problem rather than masking it with some sort of medication or other intervention? Not saying medication is bad, not saying surgery is bad. I'm not anti-medicine in any way. I do practice medicine, but 85% of chronic illness in the United States is driven by poor lifestyle and poor diet. So if we can take a functional medicine approach to patients and look at it from another way of how did we get here versus how do we just put a Band-Aid over it? So the functional medicine approach is a little bit different than, say, biohacking. Biohacking takes it to the next level of, okay, we are looking at your diet, we're looking at your lifestyle, but we're also looking at ways to really optimize your longevity. How can we make you even stronger? How can we make you perform even better? How can we take you from, say, average, if you want to call it average, to something at the next level? And that's really what I'm passionate about in my own life, and that's what I try to educate patients on. But that's one of our tenets at MedMatrix, is to really take people not only to their health optimally, but then beyond. How can we make it better? How can we, achieve a goal for a patient? How can we make them live longer? How can we make them live life optimally, more happy, more healthy? So that's kind of the difference.
Yeah, that's awesome. That makes a lot of sense. Okay, so for those who are just joining us, so functional medicine is more the medical philosophy of treating the root cause of issues, while biohacking is more what tools and resources are there to essentially push beyond the limits of what might be organically normal. Am I understanding that right, Colin?
Yeah. And one of the things I think that the traditional medical model lacks is longevity. And how do we push people? How do we get people to feeling so good? I have this conversation almost every day with my patients who are postmenopausal or menopausal women. Unfortunately, in the United States, we take women that are in their late 40s, early 50s. They're not feeling great. because their hormones are changing. And unfortunately, their hormones will change permanently for the rest of their life. They could live 30 plus years without hormones and they'll feel really bad. And the conventional medical practice for most people is they just let it happen. And I find it so unfortunate for women and men, same for men. We just let people kind of deteriorate and wither away. And when they have 30, 40 years in their later half of life to live optimally and thrive and do really great things and live great lives, that's really what the optimal part of biohacking can mean. So, yeah, you're hitting the nail on the head there, Cole, for sure.
Yeah, that makes sense. So can you give me an example of like when a patient comes in, let's say, we see a lot of patients generally older, 40 plus.
Yeah.
What are some of with biohacking? Well, I guess the functional medicine approach first and then biohacking. What are some things that you're looking for as far as like, I don't know if you can give any examples of like maybe patients you've helped recently.
Okay.
Trying to find a way to cleanly sum this up. So like what is what would a typical biohacking treatment plan look like in reality?
Like, where do we start is what you're
saying?
saying?
Like we've been very vague. Like, let's get specific. Yeah. What does biohacking
so if someone wants to biohack their health, like where do they start? Like what's the first thing they do? It's really looking at the parameters of who they are as a person, right? What their diet's like. What do they put in their mouth every day? And diet is one of the most hot button topic questions that I get with my patients. Almost every patient I see, when I get to this question, they kind of like shrug back in their chair a little bit and they're like, yeah, my diet's pretty good. Well, no, what is it? What do you eat? Like, what are you putting in your mouth every day? Are you eating processed foods? Are you eating seed oils? Are you drinking coffee on an empty stomach? Are you hydrated? We really have to look at the nitty gritty of a person to really biohack. So diet's a huge thing. We have to take really good inventory of their lifestyle, right? How much do you sleep? Do you work second shift? Do you work overnight? Do you sleep 4 hours a night because you have kids and you've got to, manage house stuff? We also extensively look at blood work. That is a huge part of the Med Matrix approach that most other people are not doing, especially in the conventional world. We want to understand what people's parameters are, what their hormones are doing, what their thyroid's doing, what their cardiac risk is like. Are they nutritionally deficient? I mean, these are things that are really baseline important for getting a patient not only optimal health, but then to a higher level. If you're trying to heal a patient from a complex chronic illness, and they have a vitamin D that's single digits, it's not going to work. So you've got to take stock of all these really, really important foundational aspects of a patient's health. And that is the sort of key and an introduction into biohacking. And then the biggest thing,
actually, wait, sorry, wrap that up. Yeah. I think you were on the same point. Wrap that up.
No, I was going to say the other thing I really think is really important is looking at a patient's goals. What are your goals? My goals may be different than your goals. I'm a bodybuilder. I track and weigh every amount of food I put in my body every day. I don't expect my patients to do that, but it's really important for me to understand where they are, what they want to do, how much weight they want to lose, so we can be totally honest about what the plan looks like.
Yeah, and that's something we'll get into about how goals matter, right? Because I know we hear this from patients all the time. Like you go into conventional medical doctor, more times than not, it's like you're in the conventional system, right? Where it's that more symptom first base approach. It's not really about your goals. It's about what's kind of average. More on that later. But for people listening, before we talk about like the more technical biohacking stuff that you would need to work with a clinic like ours to work, like what are things that patients can do on their own? Like you mentioned, not drinking coffee on an empty stomach. Like what are some of like the things that to you, it's like a no-brainer that like, it just applies to almost everyone that like, hey, these are common health practices. Like if you want to be healthy, you almost need to be doing. So like no processed foods, don't drink coffee on an empty stomach. Like what are some of the easy wins?
Yeah, these are things that I post about on social media all the time, like just basic health 101 things, because a lot of people just don't really understand these things. So some of like my top things is you got to have an adequate amount of protein at every meal, both for men and women. Protein is not a men's only thing. It's not an athletic only thing. Protein is really, really important. So whether it's lean proteins, even plant-based proteins, you need something at every meal. You need adequate sleep. If you don't sleep, your body does not regenerate. And there is really no way to optimize a patient's health when they don't sleep. I consult patients all the time that, like I said, they could be on second shift, they could be an overnight worker, and they'll tell me that they sleep 3-4 hours a night times 20 years. It's really, really hard to get a patient optimally in an optimal health status when they don't sleep. You got to move around. The second you sit down for too long, your health is going to start to deteriorate. We as humans were not made genetically, and we didn't evolve to sit down for 10 hours a day. I know it's really hard when people have sedentary lifestyles with work and an office job, but you have to find a way to move. And the biggest thing that I always tell people is cardio does not make you lose weight. Reducing the amount of calories does not make you lose weight. So you've got to lift weights, you've got to eat properly, you have to look at the body as a machine, and that's how you optimize your health. So those are like my big things. Oh, and vitamin D, that's another big one. Almost every patient, especially our patients in the northern part of the Northeast, they all have low vitamin D. So important for your health. Cannot stress that enough. Oh, Cole, I'm having trouble hearing you, man.
Sorry, this might be
There
myself.
Yeah,
Man, I want to rewind a second. You said something that was really interesting with weight loss. It's
Yeah.
not about just a bunch of cardio and calorie deficit. Because like you ask
Yeah.
anyone on the streets, like, how do you lose weight? They're probably like, oh, go do a bunch of cardio and don't eat much food. Can you explain that deeper?
So-
that was really, like, how does that, like, why is that scientifically correct? And how, like, what are the things you should be doing to lose weight?
So weight loss is one of the most common symptoms. We'll call it a symptom, but it's one of the most common goals that patients that come to MedMatrix go looking for. Almost every patient that we see, that I see anyway, I'll speak for some of my other clinicians, I'm sure they see it too, is I want to lose weight. That could be very different. Some people are 100 pounds, some people are 10, but there's some level of body change that people are wanting to adopt. So in the advent of social media, which has changed the way we practice healthcare and share information, has allowed us to share things that don't quite add up. So weight loss is not a restriction problem, right? It's not eat less, sort of walk 20,000 steps. Humans evolved in such a way that we were designed to eat all the time. And back in the day when we were only eating once a week, right? We were on the hunt, killing a wildebeest, and we would eat this massive amount of food once a week, and then we wouldn't eat for a week. We were in this constant starvation mode. So when your body is in a constant starvation mode, when you're not eating enough calories in a day, what your body will do is store almost everything you put in your mouth as fat because it thinks that you aren't starving. So if you are eating a salad, right, 200 calories twice a day, and it costs about 1,400 to 1,500 calories just for you to exist, which is your metabolic rate, your basal metabolic rate, to breathe, to go to the bathroom, to sit on the couch and do nothing. It costs a certain amount of calories. If you're not eating what that equals plus a little more, you're going to be in a constant red. And your body thinks it's starving, so you're going to pack on fat. And if you go run on the treadmill for half an hour, that's even less calorie deficit. So people that are trying to lose weight, in my opinion, I see this all the time, they are in a constant calorie deficit. So what they're doing is quite the opposite. They are getting fat as storage. Every food particle you put in your mouth is stored as fat. So it's really the opposite of what people think. They need to eat more. They need to get off the treadmill and go lift weights. That's the key to weight loss in a nutshell, right? It's not that simple, but that's kind of the starting point.
Yeah, that's contrary to even when I remember when I was in high school and like health class,
Yeah.
they taught you how to calculate the calorie deficit if you wanted to lose weight. It's like, hey, you have to be in this big of a calorie deficit. So that's
you will lose weight at the beginning, but it won't last. It'll stop, and then you'll gain back, or you'll hit a plateau very quickly. So every time I'm in the gym, when I see people on the treadmills that are overweight, I just want to go up to them and just like shake them and be like, no, this isn't, just come join me, lift some weights or something. So, but I don't want to be that guy. So,
and why is lifting weights so much better than cardio?
Lifting weights Yeah, so fat loss really comes from muscle metabolism. So when you work big muscle groups like back muscles, leg muscles, what that is doing is that is creating a fat. It tells the body to burn fat. So when you lift weights, especially for people that are older, lifting weights not only helps with bone health and longevity, but it also is what signals fat burning. So cardio doesn't signal fat burning. It's quite the opposite. So it's a very common misconception, and I wish it was much more out there in the public eye that we need to not just move, we need to lift things. So
Yeah. Thank you.
Yeah.
Aaron. That's awesome stuff. Hey, if you're just joining us now live, feel free to drop questions in the comments. If we have some extra time, we'll get to your questions. So let's talk a little bit more about biohacking. Can you give me let's get like more specific, like what does an actual, like what are you looking for when you have a patient who comes in and they're like, hey, I want to feel as absolutely optimal as possible. What specific things might you recommend? And if you can explain the science behind those things as well, that would be great.
Yeah, so some of the most common things that we utilize in, I guess if we're calling it biohacking or just optimizing longevity, is, like I was saying earlier, is really understanding a patient's baseline, what their hormones look like, what their thyroid looks like, what their nutrition looks like, basic and really vital nutrient levels, cardiac risk markers. So that is where I often start with people, is these foundational things, like what does your vitamin D look like? What does your B12 look like? Are you iron deficient? A lot of women, I see women, this happen all the time, because women that often are struggling with health issues may have irregular periods. They may have heavy menstrual cycles. They're anemic, and their doctors, they brush it off, or it's like, yeah, it's not that bad, so we're not going to do anything about it. Again, if these basic foundational things are not optimal, it's really hard for people to feel well. So for me, as a provider, the foundational pieces are so important. So I try to educate on the importance of getting the nutrients in, improving the hormone levels, looking at thyroid. So in terms of where we would start, we could start with optimizing nutrients, whether that's oral or intramuscular injections. IVs can be really helpful. Also optimizing hormone health, whether that's through supplementation, through dietary change, through actual bioidentical hormone replacement, or all of the above is usually what we're doing. Again, optimizing thyroid, looking at what the diet looks like that's affecting thyroid hormone.
Hey, real quick, how does diet affect your hormones? How are those two so closely connected?
Diet affects your hormones by the hormone production. So if you're not putting in the right nutrients in the body, you are not able to make hormones. So there are certain nutrients. So I'll use testosterone, for example, because this is something I see a lot on social media. Testosterone, for example, needs certain nutrients to be made in the body. Things like vitamin D, zinc, magnesium, certain fatty acids. So if you are deficient in these things, or your diet is really focused heavily on processed foods or fatty foods or foods with very low nutrient density, it's going to be really hard for your body to make and use those nutrients to make the proper hormones. Similar to like your immune system cells. I educate patients on this all the time. You need vitamin D for your immune system to make immune cells. If you have none or you have very little, it's very hard for your body to make the necessary cells to keep your immune system optimal. So same thing for your thyroid hormone. You need selenium, you need copper, you need zinc. If these things are deficient, it's going to be hard. So these are very basic things that we look at with every patient that walks in the door at MidMatrix. And this is how we get a snapshot of where to start and how to optimize.
Gotcha. So like so you bring in with the patient, let's say like average patient. So they're not like really, really sick, but they're also not optimal. They're still doing some things that they could do to improve their health, like for example, calories and protein and supplements. Walk me through that timeline. Like how long does it take to get a patient doing the basic things right? And then once you get there, how long does it take to use tools like peptides or bioidentical hormones with more biohacking tools to get them to 110% optimal with their health? Like walk me through that whole patient journey.
Yeah, so the patient journey really starts with looking at laboratory data, and then having a meeting with a practitioner to really understand everything. So when I see patients, I start right away, right? We look at all the nutrient levels, we assess diet, and we talk about that at the first visit. So in terms of these foundational pieces, we get started with that right away. Now, for example, something like an anemia or a vitamin D deficiency, that takes a little time to improve, but you have to start somewhere and you have to start right away. So those are things that we start right away. We talk about diet right away because that's stuff that really gets the ball rolling and gets people starting to feel better much quicker. Long-term longevity with things like peptides or hormone replacement, that is a long-term thing. When I put people on hormones, can they feel better within a couple weeks? 100%. But if you take a woman who's been postmenopausal for 20 years, it can take some time for the lights to turn back on. So what she might feel like a week after we make an intervention versus 6 months or a year is going to look different. And through that time, we're also optimizing other things. So there's a lot we can do right away in terms of nutrition optimization and vitamin and nutrient optimization, but some of the other things like hormone health and those other longevity pieces take a little bit longer, but there's certainly room for people to feel really good right away.
Mm-hmm. That's awesome.
Yeah.
What is the typical timeline you see? Like patient comes in, if they're, I mean, every patient wants to know how long until I start like feeling better, right?
Yeah.
Like obviously every patient's so different, but could you provide any insight to like what a patient might expect as far as timeline?
Usually there's simple things that we can do that help patients feel better in days, week or two. For example, I have had patients where, their vitamin D, for example, I know I keep talking about this, but it's really important. So their vitamin D is like in the single digits, right? And it's like, okay, you are going to come into the office today. We're going to give you a vitamin D injection, really high amount. And you are probably going to sleep really well tonight. You're probably going to have a lot of energy the next few days. Your lights are going to turn on, right? A lot of these patients have cognitive dysfunction and they're brain fogged. So things like an injection, an IV, that we are really, really honing in on a specific deficiency and we're giving them 100% optimization and utilization of that nutrient, we can get them feeling better instantly within hours, a day. They're sleeping better. They're not as brain foggy. So then we, as I call it, peel away the layers, right? Over the coming weeks, months, we're optimizing their diet. We're constantly checking in about dietary things. We're talking about hormone optimization. We're starting them on bioidentical hormones right away. Usually we follow up in 3 months. They're feeling a lot better. If we're talking about weight loss or weight loss specific drugs that we use, people can start to feel weight loss benefits in a week, 2 weeks. So these are just examples of things we do in the timeline.
Gotcha. So I'm going to play like devil's advocate here. So like there's all these places now like that like just do IVs, IM shots. Why not just go willy-nilly and get like a bunch of random IVs versus like, because it would be a lot more expensive to come to somewhere like MedMatrix and do a bunch of testing, meet with a doctor for a full hour. Like, why not just go kind of do this stuff willy-nilly?
Well, the willy-nilly doesn't target anybody's goals, right?
Okay.
And when you, I have respect for the IV bars and all these IV places, but you don't have anybody looking at your specific parameters, right? No one's looking at your blood work. No one's assessing your goals. No one's assessing your medical history. I mean, they are to an extent, so you can actually receive the IV or the shot, but no one is looking at you as an individual person that needs very personalized care. And while some of those interventions may help you feel better in the short term for a day or two, it's not an answer to an overall broad look at your health. Almost every patient that we see has very broad health goals that are long-standing, right? These are issues that people have had for 10, 20 plus years. Getting an IV at an IB bar is not going to solve a 20-year problem. So that's really where we differ, is we're looking at the specific parameters, the biomarkers, the health history. We're going in depth right away on the first visit to really understand all these things. And personalized healthcare is really what promotes longevity. And that's unfortunately what the mainstream medical community doesn't take into account either, is the personalized longevity. So I feel like we do that really well at MedMatrix versus other places.
Gotcha. So on that topic, could you provide an example of like a patient case study that came in and you worked with them from like, pretty average health all the way to like, using some cool things, maybe peptides, whatever it may be, to feeling more optimal, and just like your thought process, what you did to help them feel better?
Yeah. So there was a patient that I had, overweight gentleman in his 50s. And unfortunately, he he put on his intake forms and all of his paperwork that he filled out ahead of time that he was fairly healthy. And he used the term, I'll never forget this, he used the term not sick enough for conventional care. I was like, okay, well, all right. But when I assessed all of his biomarkers, he was quite overweight, and he had weight loss goals of about 100 pounds, and that was what he said. So it's like, okay. And then we went through his biomarkers, and he had very low testosterone. He had very high cardiac risk cardiac risk markers that most doctors are not looking at. We look at them to assess a patient's cardiac risk. And then he had diabetes, like full-fledged diabetes. And the really shocking thing was he had saw his primary care doctor 6 months before. And for people that don't understand blood work, he had a hemoglobin A1C of 7.6, which is a diabetes marker that we look at. Yeah, a diabetes marker that we look at, which is very high and is very well in the diabetic range. Someone that's normal will be like 5.1, 5.0. And he had seen his doctor 6 months before. And I said to him, I'm really sorry that your doctor didn't do better with you, because you don't get full-fledged type 2 diabetes in 6 months. So we did some very basic stuff at first, talking about like nutritional changes, changed his diet a lot. He was all in, he was ready to go. He understood that he had to make all the changes. And it wasn't just going to, happen by seeing me. He really had to put in the effort. So we changed his diet. I started him on hormone replacement right away, and he felt amazing. He felt something that he said he'd never felt before, was the motivation to actually make the change. So if we think about this from a biohacking perspective, right, optimizing his nutrition and his hormones specifically turned a light bulb on for him to be motivated. So that biohack of hormone optimization hacked his brain to feel more motivated. And it was almost this light bulb that he needed, and this kick in the butt that he needed to get going. So not only did I help him lose the weight, and we got him down to eventually a non-diabetic range. It takes time. It took almost a year. But there was this right away thing that happened for him when we optimized his hormones and used that biohacking tool that got him going. So this is where the journey for most people is different from a conventional setting or other types of wellness clinics. Is we can find ways to get people going that is really revolutionary. So, and I don't want to say miraculous, but I've heard that term many times, and it's really what people need to change their life. So it's an example I've used before, because like I said, it was so surprising to me that his doctor didn't catch that he was diabetic 6 months prior. It was really shocking. So yeah,
that's a great story.
Case. Yeah, it was a great case. I talk about him a lot. I've talked about him at conferences, and I've presented his case many times at speaking engagements. So really, really great guy. So these are things that we do as part of the functional medicine model, the biohacking model. This is just a basic example of what we do.
That's awesome.
Yeah.
Cool. So we're pretty much wrapping up the biohacking segment here. We got one question. So there's a lot of content around eating protein within 30 minutes of waking up. Do you recommend force feeding if it's difficult for you?
No, a lot of patients don't, and this I've seen for years. A lot of my patients don't feel great eating first thing in the morning. And that is so common with a lot of people. A lot of times it's probably having to do with their cortisol. They might have low cortisol or a low stress hormone. So they're having trouble waking up. So they're very sluggish for a while. Like they're awake, they're doing their thing, but they're very groggy. It takes some time to like turn the lights on. So in this instance, what I usually recommend is if people do better without eating first thing in the day, that's okay. Maybe they would do better with intermittent fasting. So they could fast and not eat, say, a breakfast and eat like an early lunch or something. And intermittent fasting can be very, very helpful to get your digestion going, to regulate your blood sugar. It can balance your cortisol, which is one of your stress hormones. So skipping breakfast, it is controversial, but sometimes it does well for people. But as long as the intermittent fast and some of the dietary things that need to happen are managed with someone, you can't just kind of skip meals and then you're in a calorie deficit. But that is a common thing. So if it works better for you to eat later in the morning or early afternoon, that's okay. It just has to balance with the rest of the dietary intake.
Awesome.
Yeah.
Cindy, I hope that answered your question, Colin. Thanks for the
so.
insight on that. So, all right, guys, that's a wrap for the biohacking. We kind of went into weight loss and functional medicine there. We'll probably have to do another one on biohacking so we can go deeper on some of these things. Now we're going to be transitioning into talking about vaccines, which has been in the news a lot lately. And kind of diving into some misconceptions, myths, what's true, what's not. If you're just joining us, welcome. If you've been here since the beginning, we appreciate you. Definitely comment, let us know how we're doing. We're looking to do more of these. We want to get better. If you have any questions, feel free to drop them in the comments and we'd be happy to answer them. So
things you want us to talk about.
Yeah. So let's jump into vaccine. I got some show notes here. Let's start with some context. What are vaccines? What are vaccines? How do they work? Why are they important?
Vaccines are a tool that train your immune system to recognize and fight off certain pathogens, such as a virus or a bacteria. Most vaccines are using some sort of weakened or dead germ or some sort of part, like a cellular piece of that germ, to trigger an antibody production in the body. So the idea is if you give the body a piece of this infection, the body will take that, create immune system cells to then have floating around in your body so that if you come in contact with the actual infection, your body will know how to fight it. So for example, measles is a hot topic and it's very controversial, but if you give the measles vaccine and a child gets measles, their body recognizes the bug and they can fight it off. That's like the basic 101 of vaccines.
Okay, so when are vaccines good and when are they not so good?
It's a very loaded question. So vaccines have been able to significantly reduce a lot of very major illness in the world, in the human population. So I want to make it very clear that I'm not, and I will speak for my other clinicians in MedMatrix, that we're not anti-vax, and we're in the middle, right? We look at everything in the middle. So vaccines are good because they can, like I said, help significantly reduce an illness in a human population. They are not good, though, because there are things in vaccines that can be very toxic chemicals. And I have had a lot of patients do very poorly with vaccines. They got the COVID shot or they got the flu shot and they felt really bad after. So it's not that they're outright good or outright bad. It's really from a functional and integrative medicine approach. What I try to do is try to understand, is the patient ready for a vaccine? And it has to be a very individualized thing for the person. We can't sit and say that vaccines are totally bad or totally good. I think it's a very individualized approach for a person and what their needs are, what their history is.
Gotcha. So when would be a classic example of when a vaccine would be maybe a good option? Like let's use the COVID vaccine as an example. When would that be a good idea? And when would that be a not so good idea?
So if a patient like I said, taking into account of a patient's health history, right? Is the patient elderly? Do they have high risk factors, right? Are they a healthcare worker? So in those instances, things like the flu shot or a COVID vaccine may be very appropriate because the risks of getting the infection outweigh the potential risks of the vaccine, especially, like I said, for an elderly patient or someone that has some sort of increased susceptibility, like they work in a hospital or something. Where it may not be so good, right, is if a patient has a significant medical history. Do they have a history of an autoimmune condition? Do they have something called mast activation syndrome, which is an over response of the immune system? Do they have an inflammatory condition? Is their diet poor? Is their nutrition, not optimal? Are they underweight? Or do they have cancer? All these things can play a role, and that's where it becomes very, very important to understand what back to the goals that we were talking about earlier, what the goals are to give this vaccine and why we're giving it and what the outcome needs to be. So those are things that need to be taken into account.
Gotcha. So with the COVID vaccine, it's obviously a very hot topic, and I know you just said you have patients who've come in who've gotten the vaccine and they're having issues from that. We've also seen a lot of patients we have a lot of patients with long haul COVID.
Long COVID,
I know you've helped a lot of patients with long COVID.
Yeah.
What's the difference medically between long haul COVID and having issues from the COVID vaccine after taking it?
So it's,
or are these the same thing? Or are these the same?
It's kind of could be the same thing, honestly, Cole. So it's just a different way that it happened. So in option one, you're talking about the patient getting the COVID vaccine and not feeling well after. And I've seen this a lot. Now, again, not saying I'm anti-vax against the COVID vaccine. I'm just being realistic and saying I have had a lot of patients, and I know a lot of patients that have not done well with their COVID vaccines. I just saw one yesterday. And then on the flip side, the patient had gotten COVID. They were actually acutely infected with COVID, and then they maybe got better, sort of, but then set in a lot of chronic issues, chronic fatigue, chronic brain fog, lack of physical endurance, something that we call this whole long hauler phenomenon. So it's sort of the same thing. It's just it happened in a different way. So trying to understand a patient's background is really important, and trying to understand how to optimize them is also really important. So these things we do see a lot, for sure.
Gotcha. What is going on medically? So we just got a comment here. I lost my sense of smell and taste from having COVID without having the experimental drug. Imagine that's the vaccine that she's referring to.
It could be COVID she's talking about.
Okay, maybe. What's happening on a medical physiological level that's causing long haul COVID or issues from the vaccine? I know, if you could explain that.
So it may be a little bit different depending on if it's the vaccine or actual COVID. So if it's the vaccine, it could be, again, if the patient may have not been appropriately ready for the vaccine, right? Was their body stressed too much? Did they have poor nutrition? Did they have poor nutrient status? And it created this increase in their immune system response. So that happens a lot. Versus when they get COVID, what we're seeing a lot of, and what a lot of the drug trials now are trying to target, is something called a spike protein. People probably have heard about this maybe in the media or read about an article. The spike protein is a part of the virus that sticks around after the virus goes away. And we see accumulation of spike protein in post-mortem like autopsy pathology assessment. So we've seen spike protein in people that died of COVID, and the spike protein was in the gut or in the heart or some other part of the body. And it's like, how the heck did it get there, number one? And how would we treat this if the person was still alive? So a lot of the drug trials right now are looking at how to treat the spike protein. So we think that long haul COVID might be this accumulation of the spike protein in the body, but we also see long haul COVID as a over excitement of your immune response. So you have a basic immune system when you're born. It's called your innate immune system. And what can happen with people is if their body is dysregulated, they have this over response of their immune system, and it stays, and then their body doesn't feel well after COVID or the vaccine. So it's a very, very long story for some of these, but that's kind of a Cliff Notes version of the two.
Gotcha. I guess, so are you treating patients with issues from the COVID vaccine and long haul COVID? Are you treating them the exact same, or are you treating them as far as like helping them get better?
Yeah.
Okay.
Sometimes it depends on their, I don't want to call it disability, but it depends on how bad their symptoms are. A lot of times for both, I'm looking at some of the basics, right? The foundational pieces, their nutrient status, their gut health, their hormone health, because a lot of times people aren't feeling well because a lot of that stuff was not optimal when they got the vaccine or when they got COVID. If a person, but on the flip side of that, I have had triathletes get COVID and be long haulers, and they could no longer go to work and they were medically disabled. It's like, okay, well, what the heck happened there, right? They were optimal health to start. Why is it affecting them so bad? So this is where the personalized approach comes in, and it can be really complex. But for most people, it's trying to optimize their health, trying to optimize the foundation. That's where I start. And then you sort of go from there.
Gotcha. Can you dive deeper into that? Because like this is something that boggles me, that I've heard quite a bit, and I see a lot of patients come to us who've dealt with this, where like they, you know, in your example, like they were a triathlete, they were like the top 1% of health, they got the COVID vaccine, and then now it's like they can't even get up the stairs without being out of breath. Like what happened? Like what's, and then some people get it, they're fine. Like what's happening to that?
Exactly.
Like
Yeah. So this is where trying to understand, you know, what the physiology of what's happening is important. So the physiology of how COVID works. And to be honest, I still don't think we understand it. When COVID happened, you know, we were already dealing with trying to improve people's health status. And then COVID came and it's like, oh gosh, what do we do with this? And then the COVID vaccine came and it's like, oh gosh, what do we do? We don't know. We've never done this before. So when we're looking at a patient such as a triathlete that struggles with long haul COVID or a COVID vaccine, we'll call it an injury or a you know, an issue post vaccine, we're trying to understand like things that are not the foundation, right? Do they have some immune dysfunction that is not understood, right? Like a mast cell activation syndrome issue. Do they have some sort of problem with upregulation of inflammatory cytokines? And then we can do testing for that. Is there something else that could be going on from like a medical history perspective, right, in their family history or genetics? And this is really this is where functional medicine comes in, is to sort of say, okay, well, we've got this problem. How do we look at the body as a whole to understand this? And sometimes it's not simple, but from my approach as like an Inspector Gadget or like a Sherlock Holmes kind of thing, I'm always going to look like, okay, if we can't find the answer, what else are we missing? But there could be genetic issues. There could be, like I said, immune system issues that were not understood prior, and the patient had an optimal health, so it was unrecognized. Those are common issues that we see. Also, toxin exposure is a big one that people don't know that they have, and it affected their immune system such, and then they got COVID, and that was like what took them over the edge. So there can be a lot of things. And like I said, this is how the functional medicine approach differs, and this is how we try to approach these things, is understand all of it. Because you sometimes have to. People struggle for a long time with these issues.
Yeah. 100%. So what are some of like the tools and like what are the things we can do with lifestyle medicine to help, you know, return the body to normal after long haul COVID, being vaccine injured? And what are like some of the tools and resources that we have at MedMatrix that you use on patients to, again, just get them better faster, treat the root cause of what's going on?
Yeah. So some of the things that are really helpful, again, trying to maximize and optimize dietary intake, trying to optimize and maximize nutrient intake. So, you know, we can talk about like normal levels of things, but is it optimal, right? Sometimes patients need optimal, they need extra. Patients, I've said this to so many patients, patients that have complex chronic health issues, like say a long COVID, they may need more supplementation of like vitamin D or B12, right? Their doctor might look at their labs and say, oh yeah, your labs look normal. But for that person, they need more because their body is trying to fight something. So trying to optimize all of our tools, right? Whether it's intravenous support, intramuscular support, health coaching to look at diet in more in depth, doing stool testing, right? The immune system, 80% of your immune system lives in your gut. So if you're having an immune issue, we can look at we can use advanced stool testing to say, okay, what's going on with the health of the GI? Is that really where the root cause is? So
Can you
those are
explain what
things
you
that-
mean by what do you
Yeah.
mean 80% of the immune system lives in the gut? Like, yeah, can you explain that?
So you have immune system cells that live in like nets and conglomerate together. So about 80% of the immune system cells that are in your body at any given time aggregate in the lining of the gut or in the walls of the gut. So if you have a poorly functional immune system through poor diet or lifestyle issues, or people that have had like, IBS for a long time, which is a total BS diagnosis, that could be another podcast we could do. But the health of the immune system is always going to be impacted. So trying to optimize health from a gut perspective is really important for the immune system. So,
Okay. That makes sense.
There's a lot of research that shows that disease actually starts in the gut, from cardiovascular disease to autism to neurodegenerative disease. There's all kinds of literature that supports what the gut health and the microbiome profile looks like translates into your health status long term. It's very, very interesting, fascinating, very complex.
That's really interesting. Yeah, we'll have to do a whole episode on gut health, IBS. I know
Totally.
I hear a lot of patients who say, I have IBS.
Yeah.
So, okay, let's get back on the topic with vaccines. One of
Yeah.
the ones that's been in the news recently is the hepatitis B vaccine for newborns.
Yeah.
Can you kind of, for anyone who doesn't know, bring them up to speed and explain, what's your take on it? Do you think newborns need a hepatitis B vaccine?
So it's another very controversial thing. So hepatitis B is a liver infection, which is caused by the hepatitis virus. Hepatitis usually is caused by unprotected sex or sharing dirty needles.
Okay.
So if we think about it realistically, right? Okay, a newborn is probably not doing either of those things.
Right.
Realistically. However, there is data. So that's where the controversy comes in. It's like, well, why are we protecting a newborn against a sexually transmitted infection? That makes no sense. Hepatitis B can be transmitted via childbirth. And the research shows that even a very small amount of some sort of biological fluid like blood, if there's transmission from a mother to the baby, it can transmit. So I think a lot of the conventional medical community is upset because they're saying, well, that's a big reason why hepatitis B is prevalent, is transmission via childbirth. So, which it's not technically wrong, but I think the majority of the cases of hepatitis come from these other things. So I think it's, for me personally, and as a clinician, I don't think hepatitis B vaccines are as appropriate for children because it just adds another layer of vaccine. And maybe we need to do better about, screening, when women are getting pregnant or some of these other things that we're doing. Maybe there needs to be more health care for pregnant women and women looking to conceive for some of these things, rather than blatantly giving all babies another vaccine, right? And I know that's not as simple as it sounds, but these are some of the controversial things. So as a clinician, I'm more on the side of no, because I think the data supports majority of Hep B is sexually transmitted, not transmitted via childbirth, or you're not going to see as much prevalence of that. I think it also depends on where you live, right? Do you have lack of access to healthcare? Are you in a socioeconomically, underprivileged area where there isn't some of this prenatal care? So are vaccines more important there? Maybe, but how do we regulate that? It's hard. So
okay,
yeah.
Thank you for the explanation.
Yeah,
no, I mean that was really helpful, and it makes sense, right? I mean, you got to look at this realistically. How do you get hepatitis be, and it's from needles, and
Yeah.
the approach of testing moms beforehand would make a lot more sense. So why are why is like loading up a newborn with like a ton of vaccines? Why is that necessarily a bad thing? Because you talked about how like vaccines can play a burden on the immune system. So I imagine like newborn coming out, throwing all these. I guess you explained to me why is throwing a bunch of vaccines at a newborn?
So
Why can that be a bad thing?
yeah, when you're born, you are still developing your immune system for quite a while after you're born. You don't come out with a fully functioning immune system. And one of the other things, and this is another sort of hot topic, is whether a child is breastfed or not. And I know that is very, it's not as simple. Some women can't, and there's difficulty. And I am never, as a man, going to have a comment about what a woman does. But we can understand what the medical science says. So when a baby's breastfed, they're getting a lot of the immune system support from the mother. There's immune cells being transmitted there. But even if they're not, or irregardless of breastfeeding, a baby doesn't have a fully functioning immune system. So logistically and physiologically, if we are giving them all these vaccines that contain certain chemicals and additives and preservatives and heavy metals and things that are going to make their immune system go haywire, you could argue, well, that's not going to set them up for a proper immune response. But it's not that simple either. Children are exposed to a lot of other things, and there's a lot of other things that we as humans are exposed to in terms of toxins, not just from vaccines. So to say that vaccines cause certain problems, we can't prove that, but we certainly see trends. So it's a hard thing to really understand, but the basics of it is the child doesn't have a great immune system to start because it's just not there yet. So flooding them with all this stuff is maybe not the best idea, or it needs to be done in a different way, right? Should it be staggered? Should it be introduced later? Is it done too early? Are they too close together? Those are all things that I think about. So when I think about I don't have children, but if I were to give my own kid a vaccine, right? I'm not anti-vax, but I would definitely think about the specifics of the vaccine, right? Ones that are preventing disease that has been totally eradicated, right? Okay, that's more smart than something like HPV, which, is more situational. And then I would think about, how do I optimize this, right? Do I spread them out? I optimize my child's nutrition. Do they need all their vaccines at once? Can we take off a couple and do them later? Or, so it's, again, very individualized.
I hear it. That makes a ton of sense. How could something like overburdening a newborn's immune system, how could that then, because I know there's a lot of people out there that think vaccines can cause autism or other issues down the line. How could, theoretically, how could overburdening an immune system later contribute to other health issues later in life?
Yeah, I mean, theoretically, you could think about it as, potentially a development of autoimmunity or immunodeficiency in some way. We think about, when you just look at patient populations, right there, or just think about your own life, right? Everybody in the world knows somebody that, gets sick all the time, or they have a friend that's always at the doctor. They've always got chronic health issues or whatever. So could we make some assumptions that if they were a newborn and their immune system was toyed with a little bit for whatever reason, did that cause them to be more susceptible to things later in life? Possibly. But there's just no way to prove these things. That's the hard part. But if you just think that's why logistically, it's sort of the way I approach it is it's not perfect, but how do we do it the best way to give the best potential outcome in a very difficult situation? So, but theoretically, like I said, you could introduce, immune dysfunction. You could potentially, is there risk of autoimmunity if the immune system is played with too early in a baby's life? Those are things that I consider for sure.
Gotcha.
Yeah.
Another hot topic. So those are the third one is the flu vaccine. When is that good and when is that not so good?
Personally, I'm not a fan of the flu shot because it's consistently never as beneficial and effective as we'd like it to be, because when they make the flu shot, we're using the flu virus from now, right? When they're developing the flu vaccine now that we will use in 2 years or 3 years. So by the time the flu gets here, it will have mutated. So the vaccine is not as effective as we'd like. It loses its effectiveness. So I think for most people, the flu shot can be effective, but again, it depends on them. So are they in healthcare, right? Do they work in a hospital? Are they elderly? Are they a caregiver, right, for an elderly parent or something like that? Are they immunocompromised versus not? So, I think the flu is something that a lot of people get and they get over it. But there are a handful of people, right, if their health is not optimal, they have some sort of pre-existing condition, they're elderly, immunocompromised, or if they get the flu, they could die. So in those instances, a flu shot could save their life. So it's what is best for the patient. I don't get the flu shot because I feel that I'm a very overly healthy person. I don't have a significant medical history. So if I got the flu, I got the flu, and I would probably likely get over it. But say an 80-year-old person with COPD or heart disease or all these other, conditions, if they get the flu, they might die. So more appropriate for them. Maybe, I can sit it out.
Yeah. Thank you. That makes a lot of sense. Yeah. Cool. So that's about time. So for patients who, I guess for MedMatrix, like becoming a patient, like, I guess we'll go this from the other angle. Is there someone who should not become a patient at MedMatrix? Like who shouldn't?
I don't think so. I mean,
Okay.
even the top athletes of the world, there's always something that they could do, right? So I would say that most people are not top athletes, right? That's the 1%, so the other 99% of the world has something they can work on. And I go back to my example of my patient earlier that wasn't sick enough for medical care, but he was type 2 diabetic and he didn't know it. So there's always ways to optimize health. And even if you're not struggling with a chief concern or health issues, longevity is really important. Diabetes starts in your 30s from decisions you're making. Alzheimer's starts 20 years before it starts. So decisions you make now affect who you will be in 20, 30 years. So at MedMatrix, one of our principles, our philosophies is longevity, and how do we optimize not only your health now, but who you will be in the future.
That's awesome.
Yeah.
We're going to end on that note. That was a great note. Cool. Well, everyone who watched, looks like 12 people left here. We appreciate you. Definitely give us feedback. This was really fun. I had a great time. I learned a lot. If you are interested in becoming a patient, you can go to the website. You can get $100 off as a new patient. Just click get started and you can book a call with someone from the patient coordinator team and walk you through how we can help. Until then, we'll see you in the next one. Thank you so much, Colin.
Yep. Thanks, Cole.